Hi, I'm Al Walsh and I'm the pharmacist at Fertility Pharmacy Services located at the Art Clinic in Halifax, Nova Scotia. Today I'd like to talk to you about the reconstitution and preparation of the subcutaneous injection Cetrotide. So let's get started. Before I demonstrate how to prepare and reconstitute your vial of Cetrotide, I just want to make sure that you would wash your hands thoroughly before beginning and make sure you have a clean work surface to prepare it on. So, as we begin, the Cetrotide comes in a little kit which includes one vial of Cetrotide. It comes with a 1/2 inch injection needle. It comes with a longer 1.5 inch mixing and withdrawing needle. And it comes with a syringe that is actually pre-filled with the diluent that you need to reconstitute the powder. So as I begin, I'm going to open up one of my alcohol swabs. And I'm going to use that to actually swab the top of my vial of Cetrotide. There. So to begin with, you need to remove the end cap off the syringe of diluent. And you're going to start with a yellow tipped needle, which is for mixing with and withdrawing. And you're going to actually screw that on firmly on the end of your syringe. You want to make sure that's good and tight. So we remove the cover, and what I'm going to do is I'm gently going to add the diluent into the vial of powdered Cetrotide by gently squeezing. I will reconstitute that powder. Now I'm gently going to swirl that. It may take a minute for that to dissolve. There, that's better. If it doesn't dissolve right away, you may want to just gently mix that until that goes into solution. It may take a minute or so. Once it's in solution, I'm going to use that same needle to withdraw all the solution that's in that vial. As you do this, you gently have to kind of maneuver the tip of the needle so that you pull it down toward the stopper. I'm just going to make sure I get everything. There. There we are. So I've removed all the reconstituted Cetrotide back into the original syringe. I'm going to recap this needle and remove it. And at this point I want to get out any air that's present in that syringe. There we are. I'm going to open up my injection needle. And this thread's on the end. Make sure it's a good, firm, snug fit. And I'm ready to inject. So for this demonstration, I'm just going to use an injection pad. But when you're ready to do your injection of Cetrotide, one of our nurses will go over the proper technique for making an injection. So remove my alcohol swab, and we'll say this is the area of skin where it's going to be injected, and I'm gently going to swab the area of skin. Now I'm going to let that dry just to avoid any excess stinging. And I am going to get my needle ready. I want to make sure I get just a drop of medication coming just to the tip of that needle. This one there seems to be a fair amount of space. Oops, there we are. And I'm going to go straight in. And as I count to 10, I'm going to slowly deliver that dose. 2, 3, 4, 5, 6, 7, 8, 9, 10. All the way until that plunger bottoms out. And then I'm going to count to 10 while it's still in place before I eventually remove the needle. Now, as you remove the tip of the needle, it's probably a good idea to have a tissue on hand. Sometimes there's a drop of blood or a drop of medication that'll kind of leak back out, perhaps. And you just want to use that tissue to gently massage that area, and that'll help the medication work its way amongst the cells. When you're finished, you want to recap your needle, and you want to dispose of all your sharps in the proper sharps container provided.